Welcome to This Explainer. Look, if you or someone you love has ever been pregnant, you already know it feels a bit like your body has been, well, temporarily hijacked. Today, we're unpacking the sources to demystify the absolute physical chaos of pregnancy. We're going to map out exactly what is happening, why it's happening, and hopefully provide a true survival guide for expectant parents.
Okay, let's dive right into this. Why on earth does growing a tiny human cause so many truly bizarre body changes? I mean, yes, creating life is a beautiful miracle for sure, but let's be totally honest with ourselves. It also turns the human body into a highly unpredictable 24/7 construction zone. And just like any massive construction project, there is absolutely going to be some disruption to the normal routine. So the primary culprits for this are actually pretty foundational. Your body is suddenly flooded with huge spikes of progesterone and estrogen. And obviously, your uterus is enlarging, literally pressing right up against your other organs. Plus, your blood volume shoots way up, your metabolism completely shifts gears, and your ligaments and muscles actually physically relax. These hormonal and physical shifts are the root cause behind almost all of the discomforts we're about to cover. And the absolutely crucial thing to remember? This is all completely normal.
Here is our roadmap for This Explainer. We're going to cover why pregnancy feels so weird, the gastrointestinal roller coaster, aches, pains, and swelling, sleep, skin, and stress, warning signs on when to worry, and finally, remembering it all.
Section 1. Why pregnancy feels so weird, navigating the 16 minor disorders.
Now, you might see the phrase minor disorder in the medical text. There are 16 of them, by the way, mostly hitting in the first and third trimesters, and you might just roll your eyes, especially if you're the one dealing with them. But medically speaking, minor simply means these are non-life-threatening discomforts. They don't harm the mom and they don't harm the baby. They're usually manageable with just some basic lifestyle tweaks. Minor really just means your baby is perfectly safe, even if these symptoms completely wreck your daily comfort.
Moving on to Section 2, the gastrointestinal roller coaster, navigating nausea, heartburn, and digestion.
Let's be real for a second. Taking an expanding uterus and shoving it directly into your stomach and intestines, yeah, that is a perfect recipe for digestive drama. Now, what's really interesting about this is how one issue totally cascades into another. It's like a domino effect. Progesterone spikes, right? Which slows down your bowels. That leads straight to constipation. And because you're constipated, plus you've got this heavy pelvic pressure, suddenly you're dealing with hemorrhoids. It is literally all connected. You've also got the relaxed esophageal sphincter giving you heartburn and those massive hormone spikes triggering morning sickness.
And speaking of morning sickness, which any pregnant person will gladly tell you is a massive misnomer because it can hit it literally any time of the day, it usually peaks right around that 8 to 12 week mark. So here's a super practical step-by-step routine to manage it. Step 1. Eat dry crackers before you even sit up in bed. Just keep them on the nightstand. Step 2. Switch to small, frequent protein-rich meals instead of 3 big ones. Step 3. Drink your fluids between meals, not during them, so you don't overfill your stomach. And Step 4. Absolutely avoid oily, spicy foods or any strong odors.
But listen, there is a very firm line between typical morning sickness and a true medical exception. We're talking about hyperemesis gravidarum. This is persistent, severe vomiting paired with real dehydration. If you're dealing with this, crackers aren't going to cut it. This requires a doctor's immediate evaluation to make sure both you and the baby stay safely hydrated and nourished.
Section 3. Aches, pains, and swelling, the musculoskeletal and circulatory toll.
Carrying all that extra weight and pumping extra blood volume fundamentally changes how gravity and pressure act on your body. But thankfully, there is some very actionable advice here. For backaches caused by your shifting center of gravity, wearing supportive shoes and sleeping with a pillow between your knees is an absolute game changer. For edema, you know that annoying swelling in your feet and ankles from fluid retention? You'll want to elevate your legs and try sleeping on your left side to help out your circulation. And for those varicose veins from relaxed blood vessels, compression stockings are going to be your best friend.
Section 4. Sleep, skin, and stress, full body and lifestyle changes.
Now we're getting into the whole shebang. Nervous system changes, skin adaptations, and yep, even your bathroom habits. The symptoms here are kind of all over the map. You've got frequent urination because of the pressure on your bladder and increased kidney flow. You've got fatigue and insomnia from the huge metabolic demand of literally growing a human. You might feel dizzy from low blood pressure or breathless because that uterus is physically pushing your diaphragm up into your chest. You might even notice some dark facial patches or a line on your abdomen. I really want to validate here, while this sounds completely exhausting, these are all perfectly normal, harmless physiological adaptations.
Another totally normal adaptation you might experience is leukorrhea. This is a thin, white, or clear vaginal discharge, and it just ramps up during pregnancy because of higher estrogen and extra blood flow. Completely normal. However, and this is a really big however, if that discharge turns green, gets foul-smelling, blood-stained, or super watery, it is no longer normal. That is your cue to call the doctor right away.
Section 5. Warning signs, when to worry, and differentiating normal from dangerous.
So, the absolutely crucial point here is knowing exactly when to pivot from just managing minor annoyances to reacting to a real medical emergency. To put that into perspective, let's look at swelling. If you've got swollen feet at the end of the day, but it gets better when you kick your legs up on the couch, that's a minor disorder, normal. But if you get a sudden swelling in your face or hands, especially if your blood pressure is running high, that is a massive red flag. We're talking possible preeclampsia here, which needs urgent, immediate assessment.
While emotional support and lifestyle tweaks are fantastic for those minor disorders we talked about, these next few symptoms are absolute, non-negotiable red flags. If you have heavy vaginal bleeding or fluid leakage, severe abdominal or chest pain, a high fever, convulsions, a severe headache with blurred vision, or if you notice reduced fetal movements later on, these mean a trip to the ER. Literally, no questions asked. Do not wait around on these.
Section 6. Remembering it all, the ultimate pregnancy mnemonic.
Okay, let's take a deep breath and bring the energy back up. We have covered a ton of ground today. And you might be wondering, how do you possibly keep track of 16 different minor disorders? Well, medical students actually use a very clever little trick to memorize the whole list. It goes like this. My healthy baby lives every very important safe happy second. It's a fantastic mental checklist. M is for morning sickness, H for heartburn, C for constipation, H for hemorrhoids, all the way down to VISHS for vaginal discharge, insomnia, skin changes, headache, and shortness of breath. It's a really great tool for expectant parents and doctors alike to quickly remember what's normal.
Which brings us to our final thought for this explainer. So, what does this all mean? How does knowing the difference between a normal discomfort and a true warning sign actually empower your entire pregnancy journey? Well, when you understand the why behind all the physical chaos, you take the control back. You turn that baseline anxiety into solid confidence. You stop agonizing over every single little ache and start focusing on the incredible work your body is doing to build a new life, while knowing exactly when it's time to ask for help. Thanks for joining me today, and as always, keep learning.